Artificial intelligence doctor. User question: how and when in healthy elderly people with pacemakers sudden death could occur due to nocturnal non-capture? AI medical analysis. Nocturnal pacemaker non-capture represents a serious clinical scenario that can lead to sudden cardiac death in elderly patients, even those otherwise considered healthy. This phenomenon occurs when the pacemaker fails to stimulate the heart muscle effectively during nighttime hours. Critical risk factors. Elderly patients are particularly vulnerable due to age-related changes in cardiac tissue, medication effects, and altered sleep physiology. Crescent moon mechanisms of nocturnal non-capture. 1. Lead threshold changes. Pacing thresholds can fluctuate during sleep due to autonomic nervous system changes. Increased vagal tone during deep sleep phases can elevate capture thresholds. Lead maturation processes may cause gradual threshold increases over time. 2. Circadian rhythm effects. Natural cortisol and catecholamine fluctuations affect myocardial excitability. Sleep-related electrolyte shifts can influence cardiac conduction. Respiratory changes during REM sleep may affect lead position. Pathways to sudden death. Primary mechanisms. Bradycardia-induced arrhythmias. Failure to pace can trigger ventricular tachycardia or fibrillation. Pause-dependent torsades. Long pauses from non-capture can precipitate polymorphic VT. Asystole. Complete failure of both intrinsic rhythm and pacing support. Hemodynamic collapse. Severe bradycardia leading to inadequate cardiac output. High-risk time periods. 3 to 6 a.m. Peak vagal tone and lowest heart rates. Deep sleep phases. Maximum autonomic fluctuations. Post-medication dosing. 2 to 4 hours after evening cardiac medications. Elderly-specific risk factors. Age-related vulnerabilities. Decreased cardiac reserve and slower recovery from arrhythmic episodes. Polypharmacy interactions affecting electrolyte balance. Sleep apnea increasing autonomic instability. Fibrotic changes around lead tips increasing capture thresholds. Reduced baroreceptor sensitivity limiting compensatory responses. Prevention strategies. Clinical monitoring. Regular threshold testing during device checks. 24-hour Holter monitoring to assess nocturnal pacing performance. Home monitoring systems with real-time alerts for pacing failures. Sleep study evaluation for patients with suspected sleep disorders. Programming optimization. Programming higher safety margins, 2-3x threshold, especially in elderly patients. Enabling rate-responsive features to accommodate physiologic needs. Setting appropriate lower rate limits to prevent excessive bradycardia. Utilizing advanced algorithms for automatic threshold adaptation. Emergency recognition. Family members should be educated to recognize signs of pacemaker malfunction, including sudden collapse, severe dizziness, or changes in consciousness, particularly during nighttime hours. AI-powered predictive insights. Advanced artificial intelligence algorithms can now analyze multiple parameters to predict high-risk periods. Heart rate variability patterns indicating autonomic instability. Threshold trend analysis predicting capture failure. Sleep pattern recognition correlating with pacing requirements. Multi-parameter risk scoring for personalized monitoring.